All right. Hi, everyone. My name is Audrey. I'm a PGY1 community pharmacy resident here at the University of Virginia, and today I'll be talking to you guys about strategies for effective communication. The learning objectives for today is first to describe the importance of communication in healthcare, discuss the benefits of communication in enhancing patient safety, recognize the connection between communication and medical error, and discuss and apply different communication techniques. So the Institute of Medicine defines patient safety as the prevention of harm to patients. Patient safety is the cornerstone of high-quality healthcare, and a lot of work that defines patient safety practices focuses on negative outcomes of healthcare. And that's because hospital medical errors are the third leading cause of death in the United States. Medical errors cause at least 250,000 deaths every year, and this constitutes about 10% of total U.S. deaths. There's a lot of emphasis that's placed on the systems that deliver care that prevent errors, and to learn from errors that do occur and is built on a culture of safety. Medical errors are never intentional, but how do they happen? Specifically, how do errors happen in a healthcare system? And they happen because a system is complex with many components and moving parts. Our system is dependent on many individuals and processes for success. And within our health system, we have a lot of practitioners of many different specialties. We have policies and regulations. And as you guys are very well aware of, there's also a lot of laws and regulations that are in place within our health system. And you can compare this to any other complex system as well. Road systems, rail systems, air traffic, all of these systems are very complex and have a lot of components that make it prone to errors. And they contain what we call latent errors because as humans, we are subject to commit an error. And that's okay because systems or processes that depend on perfect human performance, these are inherently flawed. But because we acknowledge human nature and we expect individuals to make mistakes, we can predict and proactively equip systems and processes accordingly to prevent errors. So a lot of big, complex health systems are usually built with a lot of countermeasures to prevent errors from happening. And these are based on the assumption that even though we can't change human nature to make mistakes, we can change the conditions under which humans work to prevent them from making them. And so this is where we come to the Swiss cheese model. And the Swiss cheese model of accident causation, it's a model that's used in risk analysis. It's an analogy that compares human systems to multiple slices of Swiss cheese. And every step in a process has the potential for failure to a varying degree. The holes in the slices of Swiss cheese are opportunities for processes to fail, and each of the slices are defensive layers in the process. And a mistake can pass through a hole in one layer, but in the next layer, the holes are in different places, and the error should be caught. Each slice of the cheese is an opportunity to stop an error, and the more defense layers that exist, the more prepared a system is to prevent an error from occurring. The presence of a hole in any one slice does not normally cause a bad outcome. Usually this only happens when the holes in the many layers momentarily line up to prevent an opportunity for a mistake. So as you can see in this picture right here of this Swiss cheese model, I've kind of outlined the different layers within our health system. So I'm just going to give you a quick example. So as the first slice of cheese, so we're going to pretend we're on the third floor. So on the third floor, many nurses have called out due to the flu. The remaining nurses that are able to work are new and do not have enough practical experience yet. One nurse fails to monitor a patient's vital signs correctly, and the patient begins to decompensate. The nurse, being inexperienced, doesn't really recognize that these signs and symptoms are severe, and she doesn't communicate to her team her observations. And so you can see how, one mistake kind of went through all these holes in all the defensive layers that are set up to prevent mistakes from happening. And when a mistake happens to pass through all these defensive layers, we happen upon what we call a sentinel event. And so a sentinel event is an unexpected occurrence involving death or serious physical or physiological injury or the risk thereof. And these events are termed sentinel because they signal the need for immediate investigation and response. And I want to point out that the terms sentinel event and error, they're not synonymous, they're not the same. Not all sentinel events occur because of an error, and not all errors are sentinel events. Just a quick example of that is an elderly gentleman is crossing the street from the main hospital to the garage, and the temperature has recently dropped, which has caused the sidewalks to become icy, and the gentleman falls and injures himself. And so you can see that this is a sentinel event, but it wasn't necessarily caused because of human error. And then the next example is you are at a filling station and accidentally place an extra tablet of atorvastatin into a patient's bottle. And while this is an error, the likelihood of it causing a sentinel event is very low. And so one way when you identify a sentinel event has occurred, one way to tackle it is something called root cause analysis. And so this is a strategy that identifies the fundamental reasons for the failure or the inefficiency of one or more processes within a system. They focus on system and processes that are already in place, not an individual or their performance. And it's a process to identify a point where an intervention could reasonably be implemented to prevent an undesirable outcome in the future. And so this analysis is meant for you to dig deeper by repeatedly asking why. Why did this happen? All right, why did that happen? And so the product of a root cause analysis is an action plan that identifies strategies that the hospital can implement to reduce the risk of a similar event happening in the future. And it's also important to note that a lot of events have multiple root causes and may require multiple root cause analysis. And some examples of sentinel events is that we see here in the health system is blood transfusions, reactions involving administration of blood products that have blood group incompatibilities, or performing an invasive procedure, including surgery, on the wrong patient, the wrong site, or even the wrong procedure. And something that we commonly see in pharmacy is medication errors resulting in patient harm. So this leads us to our first assessment question, which is, what is the best method for identifying inefficiencies in one or more existing processes? And the answer to that is root cause analysis. So the Joint Commission is an organization that helps develop standards for health systems. And every year they release sentinel event data. And sentinel events these are self-reported to the Joint Commission. And once a sentinel event is reported to the Joint Commission, a root cause analysis is required to be performed. And you can see here between the years 2012 and 2014, communication was within the top 3 factors of sentinel events. So communication can be identified in simple terms as the exchange of information between a sender and a receiver. But more specifically, it's the process where information is clearly and accurately exchanged between 2 or more team members with proper terminology and the ability to clarify or acknowledge the receipt of the information. And effective communication skills are needed to convey clear information. And poor communication in a healthcare system has been linked to patient safety outcomes. You can see here that these 3 gentlemen clearly communicated with each other, they just did not communicate effectively with each other. When you think about how many healthcare professionals are involved in a patient's care, can you see how imperative communication is in serving as a coordination mechanism? During the course of a 4-day hospital stay, a patient can interact with as many as 50 different employees. In between all these professions is also involvement of a variety of communication methods, such as fax, email, paging, notes. And so effective clinical practice involves many instances where critical information must be accurately communicated. And when this needs to happen, team collaboration is essential. When healthcare professionals are not communicating effectively, patient safety is at risk for several reasons. There could be a lack of critical information that's conveyed. You can misinterpret information, or you can just have very unclear orders. And so collaboration between healthcare professionals increases the team members' awareness of each other's type of knowledge and skills, leading to continued improvement in decision making. Studies have shown that there is a 2 times greater likelihood that interdisciplinary exchanges will result in a communication failure versus communication within your own discipline. But interdisciplinary collaboration is important because the quality of patient care is improved when members of the healthcare team work in collaboration to share their unique patient care perspectives. Each profession enters into practice with different skill sets, knowledge, professional identities to enhance the care of the patient. Yet, there's a lot of barriers that still exist between disciplines that can obstruct team-based systems. One of this could be personal experiences. So just based on your, if you worked in a previous health system, your personal experience with other professions, that can hinder and that can provide barriers to communication. There's a long history of hierarchy within healthcare teams, and interprofessional communication should emphasize good listening skills and mutual respect for all team members. And all team members should have the opportunity to contribute. There's generational differences, so me entering in to the pharmacy profession as a new grad versus those who have been in the profession for a long time. We're going to have different perceptions of healthcare and how we communicate information. There's also historical interprofessional perceptions, and a great example of this is pharmacy. And so as for pharmacies becoming more developed and more progressive, I'm actually starting to experience a lot of these historical perceptions of what pharmacy used to be. Also, the U.S. is one of the most ethnically and culturally diverse countries in the world, where there's a lot of clinicians that come from a variety of cultural backgrounds. This can introduce differences in language and jargon. There's also differences in schedules within a health system, and there's also varying levels of expertise and qualifications. And so effective teams, they must cultivate these critical interprofessional communication behaviors in order to achieve efficient and safe patient outcomes. And when a team needs to communicate complex information in a short period of time, usually it's very helpful to use structured communication. And a form of structured communication is handoff communication. And so this is a transfer and acceptance of information or responsibility that's achieved through effective communication. It's a real-time process of passing information from one individual to another for the purpose of ensuring a patient's continuity of care. It's structured and focused, and this ensures its quality of care. And while it sounds simple, a high-quality handoff is really complex. There's 3 parts of communication, which is the sender, the message, and the receiver. And gaps in communication during handoffs are a common problem in healthcare. An example that's often seen in the pharmacy profession is poor medication reconciliation. So we have started our 3rd floor pilot program for discharging patients, where pharmacists are starting to conduct discharge phone calls, and we're actually identifying that a lot of discrepancies exist at discharge, and we've identified through sort of root cause analysis that an admission history when they're first admitted to the hospital could prevent these discrepancies at discharge. And so we've identified this gap in communication, and now we have our technicians on the floor performing admission histories. And like you saw in the picture before, the problem of poor handoff communication is compounded by the high frequency of handoffs. Like I said before, in a four-day stay, a patient can interact with at least 50 different professionals. And so their information's constantly being handed, and information's constantly being added to this chain of information. And so one form of structured handoff communication is something we called SBAR. And so this was first developed by the United States Navy, and it was later introduced and adopted into healthcare. Its original purpose was to overcome communication barriers by providing a standard framework for conveying information. And so it allows efficient organization of information. It facilitates collaborative team-based practice and communication, including shared decision-making. And it can be used as a verbal or written tool for conveying information. And the acronym for this stands for S is for situation, B is for background, A is for assessment, and R is for recommendation. So we're just going to go through a quick example for SBAR. So you are the night technician, and you're about to end your shift. As the day team comes in, you would like to tell them about a difficult patient that came in to a pharmacy overnight and was upset about the cost of their medications. So, situation. What is the situation you're referring to? You want to briefly state the problem, when it happened or started, and how severe you think it is. And this should be very short, succinct, and take up only about 10 seconds. So in the example that I gave, you could be like, I would like to inform you of an overnight patient that might be coming in during your shift today. Their name is John Smith, and his MRN is 123456. Mr. Smith came in overnight to refill his prescriptions, but became upset at the register when he was told the cost. You also want to make sure you don't, if you're speaking to other health professionals, you want to identify yourself, and you want to use 2 patient identifiers, because in the health system, you guys have probably seen that multiple patients can have the same name. The background is to provide information that is pertinent to the situation, and it's important that you don't give a patient's full history. You want to also keep this short, and you only want to give information that's pertinent to the situation. So in the example that I gave before, you could say, it looks like his copays have been less for his previous fills. During the assessment, you want to provide an assessment of what you think is going on and consider the various options. Also, restate how severe the problem seems to be. So, in relation to Mr. Smith, he has Medicare, so he may be in the donut hole. I spent several minutes speaking to him about the situation, but I'm not really sure if he really understood me. He might benefit from further education. I also noticed that he has not applied for financial screening. And then lastly, your recommendation. This is your recommendation for resolving the situation. And for a lot of people, this step is the most intimidating, because sometimes you can start have an overcoming sensation of unexperienced, or you're worried about making an incorrect recommendation. So it's important to remember that you're not making the final decision. This is just your recommendation. This tool is to help outline your thoughts and to present it in an organized fashion. So for Mr. Smith's example, I think he may benefit from financial screening. If he comes in later today, would you please direct him to patient financial assistance so they can help start his application? And then in a situation where you're communicating to a pharmacist or a physician on the floor, you can always say, could you please give a second opinion? That's always a reasonable recommendation. And this leads us to question number 2, which is, what does the A and S bar stand for? And that's assessment. So STIC. This is another structured briefing tool, and this was developed by the U.S. Forest Service to give direction to firefighters in the event of a forest fire. It's very similar to SBAR, it just stands for different things. So S still stands for situation. This is what I think we face. T is for task. This is what I think we should do. I is for intent. This is why I think we should do it. C is for concern. This is what I think we should keep our eye on. And the last C is for calibrate. Let me know what you cannot do, what you don't understand, or if you have any ideas. So our second example is, you are the lead technician of a high-volume pharmacy, and your shipment of medications has been delayed due to inclement weather. You need to communicate the situation to your pharmacist and your other team members. So for a situation, you could say, our shipment of medications has been delayed and will not be arriving today. There are some patients that are expecting this delivery for their medications. T for task. I think we should call all the patients that are expecting medications from today's shipments and offer a voucher, if possible, or to transfer their medications to a store that has in-stock medications. I is for intent. I think we should do this because we want to maintain a good and honest relationship with our patients. C for concern. Some patients may become upset at this situation. And then the last one, calibrate. Let me know if you do not feel comfortable with an individual or if you have any other ideas. The third question, why are communication techniques like SBAR and STIC effective ways of exchanging information? And yes, it's all of the above. It provides a structured and organized way of communicating information. It helps eliminate confusion within communication. It allows you to communicate complex information in a short period of time. And the last question, who are these communication techniques best suited for? Is it A, nurses, B, physicians, C, pharmacists and pharmacy technicians, or D, all of the above? And the answer is D, all of the above. All of the health professionals within our health system could benefit from using structured communication. And so the take-home points of today's lecture is effective communication skills are needed to convey clear information. Poor communication in a healthcare system has been linked to patient safety outcomes. Communication within your team, as well as interprofessional communication, are important for ensuring quality patient care. It's important to promote a culture where there is a shared commitment to patient safety, and you also want to value errors as opportunities for learning and improvement. And with that, I can take any questions. Thank you.